set up the ventilator. I've already attached these. This is your expiratory with the filter, so that just goes on here. Here's your inspiratory, so you put that on there. I've already hooked up the filter. We have the corrugated tubing to the suction to the test lung. So, now I'm going to just say that this ventilator is not inpatient use because it doesn't pass the pre-check, but when you first turn it on, that's the first option it gives you, is to do the pre-check and run it. You just follow the on-screen prompts. Let me grab my scenario. So, what we're going to do this time, we have a 5'6" female. So, the ideal body weight is about 61 kilograms. So, since it's only the tidal volume, we're going to go in volume control, ventilation. So, for the tidal volume for her, you could go to either 420 or 430. So I'm going to do 420. We're going to do a rate of 12, PEEP of 5, 100% because we don't know what she's on at this point. Actually, she's on 100% ambu bag. We're going to do an eye time of 1. We're going to leave the trigger set at 3 liters. Then, okay, I think that's all my settings. Now we're going to look at our alarm, and we have the same alarms I had set before, so I'm not going to mess with it. We're going to do the upper pressure. Let's do this. Well, I'm going to mess with this one to 35. So if it hits 35, it'll alarm. We're going to leave the minute volume because with the test lung, I'm not getting huge minute volumes. The respiratory rate, we're going to leave it the lower limit of 10, upper limit of 35, and we're going to leave the end expiratory pressure alone. So now we've got our settings done. We can start ventilation. So I'm going to have to change the alarm for minute volume because we're not getting that 4, so I'm going to put it back down and accept it, so it will, with it not passing the check, it alarms for air supply, and there's a couple other things it didn't pass. So we're just going to leave the alarm off. Although in a real patient situation, we'd make sure it was on at 100% so everyone could hear it if something went wrong. Now I'm gonna, let's say I'm gonna suction the patient. Have the suction hooked up. We're gonna, if I had the canister in here, I'd have it hooked up to this, or been on. So what I'm gonna do, I'm gonna take this and put it in here. We're going to push the button and pull out. And then we've suctioned the patient. You can also put a lavage in there by doing this. You can put it down lower. And now that we've done all that, let's say her sats are at 100. So we're going to start weaning her down. These knobs down here, I can change the concentration. Say we want to go to 85. Now it's set at 85. So that's all set. And let's say we've weaned the patient off the vent and we're going to put it in standby. So we just hit the power button and turn it off.